Hello, my name is Dr. Sanket Pisat and I am a consultant gynecological minimal access surgeon practicing in Mumbai, India. In this video today, we are going to be discussing hysteroscopic removal of polyp, also called as hysteroscopic polypectomy. The normal female reproductive system consists of the uterus, which lies in the center, and a pair of fallopian tubes and ovaries, one on each side of the uterus. This uterus is the organ that normally harbors the child and where the pregnancy grows. The uterus has an inner lining, which is also referred to in medical terminology as the endometrium. On the two sides of the uterus are the two openings of the fallopian tubes, also called as the tubal ostia. So there is a tubal ostium on the right side and a tubal ostium on the left side. Normally, during the process of intercourse, the sperm enters through the vagina and the egg or the ovum is released by the ovary. The ovum then travels through the fallopian tube and the sperm travels through the uterus until finally both of them meet inside the fallopian tube at a point somewhere close to the tubal ostium. Once these two have met, the pregnancy starts forming, and in due course of time, this pregnancy finds its way back into the uterus as shown by the golden symbol called the embryo. Sometimes a localized endometrial overgrowth, which is called as a polyp, prevents this from happening and prevents the embryo from implanting or growing inside the uterus, causing infertility. This is the normal view of the inside of the uterus, which is a spacious cavity, and you can see the right tubal opening, which is seen from inside the uterus, and a mirror image of this, which is the left tubal opening, which is also seen from inside the uterus. So the endometrial lining is normally smooth and does not have any localized outgrowths seen. In this second patient, we will see that the left and right tubal ostia are seen, but there is a localized endometrial growth which is seen at the 6 o'clock position over the posterior surface of the uterus, which is a small endometrial polyp. This endometrial polyp may or may not be cancerous and can cause heavy menstrual bleeding and irregular periods. So using a surgical micro scissors, the polyp is cut from its origin with the hysteroscopic scissors. Because we are using a magnification of up till approximately 20 times the normal size, the tissues appear to be magnified and precise, clear surgery can be performed. Once the polyp has been detached, the polyp is held with a grasping forceps and gently removed from the patient's body without causing damage to any other structure. Sometimes the polyp may grow to very large sizes. Here we can see a very large fleshy polyp on the top of the screen, occupying almost the entire uterine cavity and replacing the entire space available inside the uterus. So the uterus lining is seen on the left and the polyp is seen on the right, and they are joined by a vascular stalk which supplies blood to the polyp. Needless to say, this polyp will not allow any pregnancy to grow inside. So the base of the polyp, or the stalk feeding point of the polyp, is cut with the hysteroscopic micro scissors and slowly and steadily detached from its attachment points of the uterus. As the polyp is freed, small amounts of bleeding is noted, but this usually controls itself and is not a cause for concern. Using gentle strokes of the scissors, in a matter of a few seconds, the polyp can be detached completely, as seen in the video. As soon as the polyp is detached, the polyp can be removed from the patient's body either by using a hysteroscopic grasper or by other instruments available. Here we can see that the polyp is now completely detached from the uterus. Patient has immediate relief of symptoms and may even get pregnant without any support. If you liked the video, please click on our icon to subscribe to the channel and keep receiving more updates. Thank you.